Hi everyone, my name is Yue Zheng. Today I'm going to talk to you about fentanyl. In recent years, we have seen a drastic increase in fentanyl overdose across Canada. And BC was one of the regions that impacted the most by the fentanyl crisis. You may be wondering, how is fentanyl affecting BC? According to the BC Coroner Services, in 2017, there were 1,156 fentanyl detected drug overdose deaths, which is accounted for approximately 81% of overall illicit drug overdose death. Now here the question comes, what is fentanyl? Fentanyl is a synthetic opioid painkiller medically used for managing severe acute or chronic pain. It is 50 to 100 times more concentrated than morphine, and the equivalent of 2 grains of salt can be lethal. When prescribed for medical use by a doctor, the dose of fentanyl is measured in micrograms, 1/1,000,000th of a gram. So exactly how small is a microgram? Let's picture a typical pill you might take for a headache. Ibuprofen, for example, which is 400 milligrams. Try cutting that pill into 400 pieces. Each is a milligram. To get a microgram, the same pill would have to be cut into 400,000 pieces. However, the fentanyl that is sold in the illegal drug market is hardly ever diluted to the precise microgram and is often mixed into other types of illicit drugs, which is why the risk of overdose is incredibly high. Illicit fentanyl comes in different forms: injectable liquid, tablets, such as fake oxycodone, patches, and powder. So how does fentanyl harm your body? Fentanyl can cause respiratory depression. In other words, it suppresses your ability to breathe. Your brain and other organ systems can't get enough oxygen to function, which would eventually lead to death. An overdosed individual often presents with symptoms such as small pinpoint pupils, dizziness, confusion, very shallow or stopped breathing, bluish tint to nails and lips, and loss of consciousness. When you suspect someone is having an opioid overdose, there are a few things you can do. Call 911 immediately. If the person is not responsive, give chest compressions or CPR. Administer naloxone as instructed. Then adjust the person in a recovered position so that he or she does not choke on vomit. Remember, you can save a life. Thank you for watching my video. I hope it raised your awareness to the issue with fentanyl, and I'd love to hear your thoughts on the topic. And if you have any questions, please feel free to comment in the discussion forum below.